after a patient has an abstraction and they come into you and they're wanting to know what are their options if they have a missing tooth?
Well, I always go over this with my patients. I tell them there are really 5 options. And the first option is to do nothing. You know, you don't have to replace every missing tooth. You're not going to talk different or look different, or you're not going to have chronic pain in the area where you don't replace a tooth. But not replacing a tooth can set you up for future problems in terms of other teeth shifting. And if those teeth shift, they can have problems with gum disease and cavities. So tooth shifting or drifting can be a problem for those who choose not to replace missing teeth. In the front of our mouths, most people in this area aren't going to go that route. They're going to replace that tooth with something. And those options would be something removable, like our grandparents had. You know, you remember those days where they'd get up in the morning and take their false teeth out of the glass of water on their nightstand and shake them off and put them in their mouth. So those are still around. They're not as common anymore, and they're usually used for short term, but they're still around as an option to replace teeth. A more long-lasting option would be a bridge, where we end up using support from neighboring teeth. The dentist would put a crown on neighboring teeth and a bridge over the space. And bridges, according to textbooks, aren't supposed to last forever. So they can last 7 to 10 years. Decay occurs underneath the bridge, and then the bridge ends up being redone at some point in the future. And that ends up costing more. So it's not as simple as just taking the bridge off and redoing it. It's take it off, maybe do a few root canals, and then redo it. The fourth option would be a dental implant, which is really the gold standard. It's the only thing in dentistry meant to be permanent. It really is intended to be lifelong. Depending on where we place them in people's mouths, it can be up to a 98% lifelong success rate. And the implants that I use, the company I partner with offers a manufacturer's warranty. So if it doesn't last a lifetime, patients get a free one.
That's great.
They don't have to pay for another one.
Wow.